Hello medicos. Today we are going to read about the ovarian cancer, and this is a very important topic according to your exam as well as from the NEET exams. So here we start. This is a ovarian cancer. You can see here's you can see a normal ovary here. This is cervix, this is body, this is fundus, this is ovarian ligament, this is fimbriae, this is ovary. Today the contents of our topics are the first we read about the introduction, then the types of the tumors, then symptoms, then causes of the ovarian cancer, diagnosis of the ovarian cancer, stages of the ovarian cancer, then the treatment of the ovarian cancer, its side effects, prevention, consultations, and reference. So here we start our topic. This is the normal anatomy and physiology of our normal ovary. So it is a female organ, glands producing the sex hormones and the ova. Size of the ovary is long, 2 centimeter wide and 1 centimeter thick. Shape is almond shape, and the location of the ovary on each side of the uterus in the pelvic. Ovarian tumors. The tumor of the ovary are common from the neoplasia in the women. Accounts of the 3% of the all the cancers in the female, 80% are benign. I know, I hope you know the meaning of benign. It means it is not generated from the metastatic. It means it is not transferred from the like one place to another place. From where it it starts grow, it stay there. And as you see, more common in older white women of the northern European ancestry. 90% of the malignancy are carcinoma, 80% spread beyond the ovary at the diagnosis. These are the types of the ovarian cancer. The origin, you can see the surface epithelial, as you can see here, and the germ cell here. You can see this is germ cell, and this is the sex code here. The stroma. This is the metastasis of the ovary. You can see the non-ovarian primary tumor. Origin, I would like to explain the classification of the ovarian tumor. Overall frequency is 65 to 70% in the surface epithelial cells, and 15% to the 20% in the germ cells, and the sex codes which is 5 to 10%, and metastasis to the ovaries in which the overall frequency is 5%. The proportion of the malignant ovarian tumor in the surface epithelial cell is 90%, in the germ cell is 3 to 5%, and in the sex code stroma is 2 to 3%, and in the metastasis of the ovary is 5%. Next one is the age group affected. The surface epithelial carcinoma is mainly affects the 20 or more than that age of 20 plus, and in the germ cell it is mostly 0 to 25 plus years. It means the peoples who is more than 25 years old, they are more prone to germ cells carcinoma. The next one is sex code stroma. The sex stroma is, there is no significance about the sex chrome stroma. This is found in the all the ages, and metastasis ovary is variable. It means it can be occurs at the any stage of the lives, and the types. So here we see the types of the surface epithelial cells. The first type of the surface epithelial cell is serous tumor. The second type of the surface epithelial cell is the mucinous tumor. The third is endometrioid. The fourth one is ciliary cell tumor. The fourth one is Brenner tumor, and the last one is cystoendofibroma tumor. And the types of the germ cell cancer is the tetroma, and this is the dysarthria, endothelial sinus tumor, or corneocarcinoma. These are the types of the germ cell cancer. Now we read about the sex code stroma types. The first is fibroma, second one is the granulosa thicca, third one is cell tumor, Sertoli or leading cell tumor, and no metastasis to the ovaries types we read. Here we see about the histopathology of the serous tumor. It is one fourth of the all the ovarian tumors. It means number of cancers you found. It is mainly one fourth of the all the tumors. It is mainly found in the adults, and it is 30 to 50% in bilateral. Bilateral means it is found in the both the ovaries. 60% is benign. Benign, as I already explained you about the benign cancer. 50% is borderline and 25% is malignant. Malignant means it the cancer which is transferred from one place to another place. It means if the cancer is occurs at the ovaries, it can transfer it to the breast. It can transfer to the lungs. The third point is the papillary formation present. So in the serous tumor, you can see the papillary formation is present. The microscopic appearance of the serous tumor is cuboidal to the columnar cells lining cell wall of the cyst and papillae. You can see pachinoma body is 30%, and it is the histopathy of the serous tumor. You can see here. Second one is serous cystoidenoma. It is cuboidal to the columnar cells are seen lining the walls of the cyst and the papillae. It is better differentiated tumor. It is low, so you can differentiate this tumor to the another which we read earlier. This is the serous cystoma gross. This is the gross appearance of the serous cystoidenoma. This is the gross picture of the cystoma like cancer. Ovarian cancer. So here we talk about the stages of the ovarian cancer. So basically we have the four stages of the ovarian cancer. This is the first stage. You here see the normal, it is look like a normal ovary, but it is not normal. Here you can see here the cancer tissue is present. I mentioned it. This is the cancer tissue. Cancer is found in one or in the both ovaries. So I told you it may be bilateral or it may be present in the one side of the ovary. Stage 2. This is the stage 2. Here you can see the cancerous cells have spread from the ovaries to the other part of the pelvis, such as the fallopian tubes to or to the uterus. So here you can see in the type 1 that cancerous tissue is present here, but now in the stage 2 this is spread to the fallopian tube and in the uterus as well as. And now we discuss about the stage 3. So in stage 3 the transverse cells are have spread outside to the pelvis to the nearby lymph, diaphragm and intestine, or it's to the livers. So it means it is all about the malignant tumor. It is not about the benign tumor, because I told you benign tumor is not spread from the one place to the another place. So it is spreading from one place to the another place. As you can see, it is spread from the diaphragm. You can see the transverse colon. You can see, you can appreciate the cancerous tissue here. This is the cancerous tissue. This is normal. This is our ovary, and it is spread. It is spreads to the transverse colon as well as you can appreciate here on the diaphragm as well as. So it is a malignant tumor. And we talk about the stage 4. The cancer has spread beyond the abdomen, such as to the lungs or the spleen. So it is also, we are talking about the malignant tumor. So in this stage, in stage 4, the cancerous tissue crosses the abdomen and it is reaches to the lungs as well as the stomach. I know stomach is found in the abdomen, but it is cross the abdomen and it reaches to the lungs and the spleen. And here, if it is not treatable here, it can reach to the breast as well as, and then it can reach to the brain as well as. The risk factor of the carcinoma are nullipriority. Nullipriority, I hope you know the meaning of the nullipriority. Then the family history. The family history is very important about the carcinoma. Childhood gonadal dysgenesis, columbifany, hereditary or non-polyposis colon cancer, BRC1 and BRCA2 mutations. These are the genes present in the normal human being, and if the mutation of these genes occurs, then it will lead to the carcinoma of the ovaries. CA125 present in the 80% of the serous and ethmoid tumors. Cystogenetics gain of 12 and 8, these are also your genes 12 and 8. So the mutation occurs in these two. The loss of chromosome X 22, 18, 17, 14, 13, 12 and 8 as well as. So if the loss of any of them occurs, then it will lead to the carcinoma. Benign borderline tumors exhibits trisomy 12. These are the risk factors. Here you can see the symptoms of the ovarian cancer. Here you can appreciate this is the normal ovary. And this is the uterus, this is vagina, and here you can see the cancer of the ovary. So the symptoms of the ovary are, you can see, digestive disorders, the loss of appetite as you appreciate on the picture. This is the swollen abdomen and the bloating here, the stomach aches occurs, the disturbance in the menstrual and the hormonal disorders as well as you see. So that you can appreciate the mood swings in the patient. The patients come with the complaint of the stomachs bloating, the loss of appetite and the weight loss, and the digestive disorders as well as like the constipations and other things. So please, if you like the video, then like it, comment, share and subscribe, and thanks for the watching, and have a good day and great